Even good evening. I'm Councillor Graham Bridgman. I'm Deputy Leader of West Berkshire Council. I'm also Executive Member for Health and Wellbeing, and I chair the local Outbreak Engagement Board. This evening I'm supported, I'm just looking around the room as I say the names, by Councillor Stewart, who is the Deputy, the Vice Chairman of the committee, Lynn Doherty, Steve Masters, Dominic Verk, Martha Vickers. We also have with us Nigel Lynn, Chief Executive. We have Matt Pearce, who's our Service Director for this area of the work of the Council. Sean Murphy from the Public Protection Partnership, and Martin Dunscombe from our comms team. I'm very pleased to welcome, although she's not yet on screen, but I think hopefully she can hear us, Tracy Daskovitz, who is the new, very new Director of Public Health for Berkshire West, and also Joe. Good to see Joe Reeves back with us, who's CCG Newbury Locality Manager, but will no doubt be talking to us about vaccinations, won't you, Joe, in the place of who was going to speak to us, normally Katie Summons, but I think you're here in her stead, aren't you? So that, I hope I have covered everyone in the room. Gordon, do we have apologies?
Mr. Chairman, we have apologies from Andy Sharp and Katie Summers.
Okay, and just to round everything off, Gordon Oliver is clerking the meeting and is Zoom host, and we are streaming to YouTube. So, members, we start with the minutes of the meeting that was held on the 8th of November. Just going to see whether anyone has any amendments they want to make to those minutes. For those of us who were there, nobody itching to speak. So I will propose those from the chair. Thank you, Councillor Doherty, for see a seconder. Usual hand in front of this camera to vote in favour for the minutes. Thank you. That's, I think, unanimous of the members. Thank you. Move on. Next item on the agenda is declarations of interest. Members, does anyone have a particular interest they wish to declare? See no one itching to do so, so we'll move on again. Okay, so we get on to the meat of tonight's meeting, and just to reflect that, as we said last time, we stand up and stand down local outbreak engagement board to reflect on the situation as vis-a-vis COVID as it exists both nationally and locally, more particularly locally. And I had discussions with both Matt and the previous Director of Public Health about whether or not we should be standing the board back up in the light of, particularly in the light of, I'm going to say it's Omicron. It could be pronounced all sorts of ways, and I'm not a classicist, so I apologise to any classicists watching if I get the pronunciation wrongly. Local rates of infection of COVID in our community, and the vaccination programme, but particularly the emergence of this new variant. So, situation report. Matt, over to you to talk us through.
Thanks, Chair. Evening, everyone. So just going to take you through a brief summary of where we are with regards to the epidemiology. And then I've got a few slides at the end just to give you a bit of an update in terms of what we know around Omicron to date, which is the new variant, what additional measures have been put in place as a result of that. So that summary slide you'll all be familiar with, just showing each of the local authorities in Berkshire and how we compare to the regional and national average with regard to the latest COVID-19 data. So this is the full data's worth of 22nd November to 28th of November. As you can see, our testing rates are going up actually. We are receiving reports that testing demand is quite high across West Berkshire and putting pressure particularly on our regional testing site in Newbury, Newbury Showground. So really good that people are being proactive and getting testing. Just to remind people that people can still get their tests online as well as Newbury Showground. In terms of positivity rate, that's 11.1%. So still around 1 in 10 people that testing are actually testing positive. So that remains quite high. It was about 12% a few weeks ago, but it has dropped a little bit. In terms of the cases per 100,000, these for all ages, it's 542 per 100,000. So that fares slightly better than the Southeast average, which is around 590 per 100,000, but higher than the England average, which is 442 per 100,000. Again, that's gone down, although I think the latest data that's come out today suggests around 580 per 100,000. So we're still seeing very high incidence, and I need to make that point. Whilst it is stable, there's a lot of people that are still getting infected with COVID-19. If we look at the 60 plus age range and rates, it's about 156.2. Again, that's slightly come down. Again, if you look at the last 7 days, that's 860 people that have actually been infected with COVID-19, and we've had 5 community outbreaks. We're still very much seeing those outbreaks in primary school driving a lot of the transmission. I'll come on to the age ranges in a minute. And again, you can just see the epidemiology of the cases here. So just to remind you, West Berkshire is the blue line, South East is the orange, and the England 7-day rolling average is the grey. So again, apart from that blip in October, which we know is likely down to the Immensa lab incident, it dropped quite significantly, and we've been relatively stable through most of November. So just referring to the age cases which I mentioned previously, so again, you'll be familiar with this heat map. This is right the way back from April 2020 all the way to the present day here. The darker colour just showing the higher number of rates per those ages. And I've actually just listed the rates. So you can see the 5 to 9 years is quite high at nearly 2,000 per 100,000. So that's clearly where we're seeing a lot of the transmission, those individuals that are affected. 10 to 14 is 1,327 per 100,000, and 15 to 19, 329. So again, this figure, particularly in 15 to 19, you recollect a few months ago, that was high, but that's coming down again, likely down to a number of things in terms of vaccinations and perhaps some element of natural immunity as well. The hospital data for Royal Berkshire, so again, just emphasising that point, but whilst we are seeing high levels of community transmission, patients in hospital at Royal Berkshire has crept up a little bit, perhaps through November, but it's around 35 patients was in hospital on the 30th of November. So it's kind of fluctuated between 20 and 30 to 35 over the last few weeks or so. And then patients admitted to hospital, again, it's a similar picture here. There are 4 patients on the 28th of November, but they are seeing some pressure around intensive care units of 4 patients from mechanical ventilation on the 30th of November. So clearly, when you compare back to January, it's faring certainly better, but that's not to say hospitals aren't under any pressure at all, because they're certainly experiencing winter pressures due to a whole host of other issues. I often get asked about other hospital data. I just thought I'd just quickly cover Great Western, for example. I know that's not the only other hospital our residents use, but it just really shows a similar picture. It does look a little bit higher because the axes are slightly different here, but in general, very similar patients in hospital. Great Western, 32 COVID, and patients admitted 4, and then 2 on mechanical ventilation. So just to emphasise the point that it's that same picture really across our neighbouring hospitals. The deaths again, obviously sadly there has been a death reported the last week's data we had. There's been 275 COVID related deaths since the start of the pandemic, and this chart you'll be familiar with. The grey line just represents that 5-year average weekly death rate between 2015 and 2019, and the blue indicate COVID related deaths. So we had 1 the week before, unfortunately, week before that there was 3. So you can start to see there have been a few, unfortunately, COVID-related deaths over the last few weeks, but certainly nothing to what we experienced back last year. So I just thought I'd cover about Omicron really, and what we know, what we don't know. This is quite a busy slide, but I'll just briefly go over it. I think the key thing is that there are concerns around the number of mutations and potential impact that Omicron might have on evading both natural and vaccine-induced immunity. So there's certainly lots we don't know. But what we are thinking, what we're suggesting from the UK Health Security Agency is that Omicron is actually more transmissible. The key question is actually, if it's more transmissible, will it actually lead to more severe health outcomes? So that's certainly something that the UK Health Security Agency and other epidemiologists are looking into. There's also a strong indication that the window between being infected and becoming infectious is shorter than Delta. So really important why testing should be done as soon as possible. As I mentioned, we're not seeing large number of hospitalizations or deaths, but we're very much at the early stage of that variant. So I think over the next 2 to 3 weeks, we'll start to see whether the impact on hospitalizations does materialize. And some of you may have heard the Secretary for Health talking a little bit ago about some pockets of community transmission already existing in the UK now, and there's up to 261 cases in England that have now been recorded. There's likely to be many more. And I can also say we are aware of one confirmed case of Omicron in West Berkshire, and that individual is being supported through the UK Health Security Agency. And like I said, I think we'll likely see more over the coming days and weeks, as it's likely that Omicron will become the dominant variant across the district. It's important to note that obviously the government's put lots of rapid measures in place, but to note that actually this will only delay and not prevent the spread. And that's really what it's all about. It's about buying time so we can learn more about what this variant is like and what that impact will be. And one of the reasons it's hard to understand what that variant is like is because it's hard to draw comparisons to South Africa due to their different demographic and that more of their population tends to have natural immunity. So what we don't know is how successful our vaccines will be with regards to combating that variant. And I said a lot of the analysis done today is down to understanding what the structure of the viruses looks like and the development of the vaccine rather than real life data. And the second from last point is quite important. I think it's worth noting that, which is why everyone's quite cautious and why some of the measures being put in place is actually when Delta come along, you might remember we just come out of a lockdown. It was summer, it's warmer weather, so more people were spending time outside. However, we're in a slightly different position now where we have a higher incidence of COVID. It's winter, more people are inside. But although we do have a higher uptake of vaccines, so it probably won't take much if this variant does have a bigger impact on health outcomes, deaths and hospitalizations to put that pressure on the NHS. So that's really why all these additional measures are being proposed by the government. And I think the key thing to remember, and Joe will come on to this into the vaccines, although we're still unsure about the vaccine's effectiveness with regards to the new variant, it is likely that they will continue to protect people from severe forms of COVID-19. So it's really important to continue to encourage people to get their vaccine. But obviously more data will come out over the coming weeks and days. So just quickly around some of the control measures, I've just highlighted the ones in blue, which I'll go over really. These are the new ones that everyone needs to be aware of. So if somebody is identified as having the Omicron variant, all those close contacts of that confirmed or suspected case will be required to self-isolate for 10 days, irrespective of age or vaccination status. So again, those individuals will be contacted through specialist staff within NHS Test and Trace. And I think many of our residents from what I was seeing at the weekend are fully aware now that you need to wear face coverings in shops and public transport. And it's important to note that these are all temporary measures at the moment. So again, it's just so we can get a better understanding of what this variant is like and the impact it will have. There's lots of other COVID measures that are continuing to be advocated down there. The other one I probably would just like to point out is this change in guidance around rapid lateral flow tests, where the government are being asked people to undertake them ahead of a high risk situation that day or before they might visit people at a higher risk of severe illness. And again, there's lots of opportunities and ways to get hold of your lateral flow testing kits. My last slide is just some additional control measures, which many of you will be aware of. In schools, face coverings are being recommended for all staff and students and visitors in communal areas. In West Berkshire, we're actually already advocating this due to the Mensa lab and high incidence rate we had a few weeks ago. So they're fully familiar with that in secondary schools. And also testing of pupils in secondary schools is also being advised on the return in January. And I won't go over to the travelling details, but there's a range of different testing measures that people now need to undertake upon entering the UK. And once they have entered as well, they need to take a PCR test. So that's probably all I was going to say. I see Councillor Doherty's got a hand up, so happy to take a question.
Indeed, but before I come to Councillor Doherty, I'll take Chairman's privilege. Do we have any concept, and I take entirely what you've said about Delta being summer and people being outside and Omicron being winter, but having more community vaccination. Do we have any idea about the relative speed of spread between the two variants?
I don't think we have that information to date at the moment. I was reading about South Africa that when the Delta was prevalent, they had an R rate of 1, and over the last 4 to 6 weeks, it's jumped to an R rate of 2. So that would suggest that it's highly more transmissible, but to what extent that is, I think that's still being worked through. Thanks.
Councillor Doherty.
Thanks for your presentation, Matt. It was just to go back to the hospitalisations, mechanical ventilation, and unfortunately deaths. In the past, you've confirmed to us that they are tending to occur within the unvaccinated. I'm just looking for confirmation that's still the case, that the cases that we're seeing coming through into hospital are those that have not been vaccinated.
Yeah, certainly those that are going on to ICU, that's certainly the case. We're seeing those have largely been unvaccinated. Absolutely.
Thanks, Matt.
And Councillor Burke.
Thanks for the presentation, Matt. Matt, I've heard on the radio discussions which indicate that, or suggest that the natural evolution path for a virus is to become more transmissible but less hazardous to the host, if you like. Is that a realistic projection? And is there any evidence that yet forming that Omicron is less dangerous than Delta?
That's certainly plausible, and I've heard that theory as well. And sometimes viruses can go that route. I think at the moment in time, we just don't know. Councillor Berwick, I think we're hoping, obviously, it's certainly going to lead to less severe outcomes. But I think the suggestions are it's certainly more transmissible. But it's certainly plausible, and I think we just have to wait to see.
Thank you.
And Councillor Masters.
Thank you, Chairman. Thank you, Matt. I was going to see if anything had come up in any other questions, but there was reports that 1 in 5 of the people who are in ICU and on ventilators, etc., were pregnant women who were obviously, up until very recently, unvaccinated. You only comment about how we're moving forward in letting people know that pregnant women should maybe get vaccinations moving forward? And then
yeah, that's something I haven't seen any local data to date, and I'm certainly I can certainly look at that. That's certainly the data I've seen nationally as well, Councillor Masters, and I know that that's an area that we want to continue to push and promote vaccination. There's clearly lots of myth busting we have to overcome with regards to vaccinating pregnant women, so that's certainly on our radar and something we can take away and ensure we can get those messages out and encourage those women to get vaccinated.
Thank you.
And Councillor Vickers.
Thank you, Matt, for your presentation. I just sort of heard that the testing kits are less easy to come by now than they used to be, that you have to order them. And I'm sure I can remember just picking them up, either picking them up from the council offices or Boots. What's your awareness of that? Because they should be easy to pick up. You should be able to get your kits just by walking into Boots or somewhere, really, rather than having to go online and order them.
Yeah, there's a range of different ways. You can obviously book online. We have our mobile testing vehicle that goes around the district. Obviously, our work is very much focusing on targeted, so those individuals that would benefit the most. We have had some challenges with pharmacies where people have to collect a code to get a code to pick up a kit, but actually that shouldn't be the case in all our pharmacies. That's certainly something we're trying to resolve, and I can get an update for the following meeting or feedback after this meeting. But on that note, Councillor Vickers, the other point just worth mentioning it, we still believe the lateral flow testing kits will work even with Omicron. So I know the UK Health Security Agency just started evaluating the lateral flow test today, just to ensure that's the case. But they're certainly confident that the lateral flow tests will still work. So absolutely, I support as many people to access those tests as possible. And again, we can do more comms to encourage people to get those and where they can get them.
But, I mean, that's good to hear. And the kits are now simpler to use. They've sort of modified them a bit. So you don't have to sort of, down your throat, etc. You just use it. It's just the swab up your nose. So to make it simpler, I think. So most of the kits are like that now, I think.
Yeah, no, absolutely. And the other point I would just make as well is obviously if somebody does test positive on the lateral flow, it's really important to get a follow-up PCR, because that's how we'll be able to sequence the swab to actually see whether somebody does have the Omicron. So just to make that point, although it's optional, it's strongly recommended.
Yeah, thank you.
Thank you for that. Yeah, I'm clearly using old kits, or at least old instructions to kits. So I hear the difference in swab techniques with interest. Thanks, Matt. So we now move on to vaccinations. And Joe, just to say, Joe, that both the leader of council and I were very recently boosted. I went over to as a deliberate act. I went over to see Graham Jones at Lambourne, both to do some publicity for the booster program, which will be coming out, and Martin will no doubt talk about that when we get to it. But also to have a chat, and I'll come to his comments on the booster program from a pharmacist point of view when you have made your presentation. So welcome, Joe. Off you go.
Thank you very much for having me. I'm here representing Katie Summers, who is the Berkshire West vaccination programme lead for the CCG. So I thought, rather than starting with all the data up front, I would update on the latest elements of the programme before getting into some lovely statistics. So you will all be aware that the Joint Committee on Vaccination and Immunisation guidance was updated last Monday. So they recommended extension of the booster programme to include all adults over the age of 18. They suggested that it should be offered in descending age groups with priority to older adults and those in at-risk groups. They said that severely immunosuppressed patients should be offered a booster 3 months after they've received their third primary dose. They were offered to get 3 doses rather than the 2 everyone else did. They said that Moderna and Pfizer should be used with equal preference, and said they were both really effective at boosting immunity, and that children and young people aged 12 to 15 should be offered a second dose of Pfizer, and that should be at a minimum of 12 weeks from their first dose. In terms of what that means for deployment, guidance was issued by the NHS on Friday afternoon, so we're still going through it and figuring out how to operationalise their recommendations. But they've particularly suggested that the NHS booking system will be updated to reflect the new interval for the booster, and that will be completed by the 13th of December, if not before. I'm sure there will be lots of coverage in the national media once that's gone live. They also looked at increasing capacity across existing sites to be able to accommodate more people coming through the doors, and in so doing have suggested revising targets for GP practices to free up some of their time. So some of the things that they do, like health checks and case reviews, can be scaled back in order to enable participation in the booster programme, making available additional workforce, and there are some financial incentives in there. Although I would say just locally feedback has been it's not about the money, it's about the workforce capacity, but that is what's in the letter that came out on Friday. They're inviting new sites to sign up, hoping some of those incentives will support those that have opted out from delivering the COVID vaccination programme to come back in for whatever they're able to offer, whether that's up until the end of January, beyond, short term, so taking a very flexible approach. And just to note at this point that guidance for the 12 to 15-year-old rollout of second doses has not been published yet, or at least it hadn't when I put my presentation together this morning. So it's likely to involve the school-aged immunisation teams again. So we should see a rollout similar to the first dose. So just focusing on locally where we are, regardless of the latest announcements from the JCVI and the government, our local pharmacies have increased their capacity. So the Kennet Centre Vaccine Centre has moved to a new unit that is still within the Kennet Centre. It's now the old Peacocks unit. So they've been able to offer a far greater number of appointments. They went live over the weekend, and I've seen from the local kind of Facebook community groups good availability and people being able to get a booking within the next week, which is really good to see. And yeah, Graham Jones, spoken with him, and he was able to increase his capacity in the run up to Christmas, and he's bookable by the national booking system. Also to mention, it was published last week that we're organising a booster vaccine pop-up at Hungerford Cricket Club. That will run from the 8th to the 17th of December, apart from Saturday the 11th when the football's on. So we just can't manage the parking alongside the football club. Thank you very much, West Berkshire Council, for offering your booking system. So there's still availability there for next week, although we are sold out from Wednesday to Sunday this week. So really good to see local people taking advantage of that system. There will be some availability for walk-ins, but I would recommend booking so your slot can be guaranteed. And the eligibility is for the groups currently being called forward for their boosters. So we're still doing the 40 plus and those in COVID at-risk groups. And we're only intending to offer booster vaccines. However, for everybody, I've just managed to finalise the Health on the Move van schedule for next week, and this will be open to those for first doses, second doses, Pfizer's, everybody 16 plus. So we're taking that around the district next week, and we're treating it as far as we can as with sort of high intensity. So we'll be aiming to do about 200 a day at each of these occasions, just making sure that there is really good capacity locally for boosters and vaccines of all types, I guess. So that's all on local updates. Should I pause in case there are any questions before I go into data?
Well, let me, let's deal with the local update and the vaccination piece generally, and then we'll come to data in a moment. Good to see the moves you've made, and good to see the increase in capacity. Before I come to Councillor Bowick, I'll just, I had a couple of sort of email exchange following yesterday morning with Graham Jones, and he sent me some comments. So what I've done is I've sort of bulleted those out. So I'll just offer them up for public consumption. But Joe, to the extent that any of these might be taken back to the centre, I don't think it's necessarily aimed at Bob or the place-based partnership or the PCA. It's not that local. This is more to do with the national question, but you take it as you can and feed it back to the extent you can. His first comment is it's been a very worthwhile and fulfilling role. And he has been pleased, and the pharmacist pleased to be part of this service. And patient feedback at Lambourne, and I've seen this on Facebook, been excellent. He also says community response has been fabulous. They're supported by a number of volunteers to help out with making the operation a success. And as he says, the pandemic, as we've seen in a number of areas, has brought out the best in the community. Now, when they vaccinated and you've referenced the immunosuppressed, when they referenced that group, they were obviously receiving the third dose rather than a booster, and they'll be called back for a booster. At the time of vaccinating the cohort, they were finding it difficult to get their booster booked because the system wasn't recognizing someone who was having 4 doses rather than 3. So that's a comment on the booking system, and don't worry, he's got more comments on the booking system. Booking system can act perversely, sending patients across the country rather than to the local service. They're getting a lot of patients from Wantage, and yet they're seeing Lambourne patients being sent to Wantage. So, what's going on there? And they have no control over the booking system, and they prefer to be able to tailor their bookings to their local need. And he says that most of the people they're vaccinating are not from the Lambourne Valley. They've got NHS permission to do a number of evenings for the clinically vulnerable and immunosuppressed from Lambourne and Hungerford, and that's been outside the national booking system. So there is some flexibility, but perhaps, you know, these things all need to be fed into the centre. Pop-up service going into Hungerford, and you've referenced that, will hopefully take some of the pressure off them, because they were finding themselves doing a lot of Hungerford patients because of the lack of a facility in Hungerford, which are now addressing. But what he does say, and this was something that Julie, his wife, who was helping him, raised as well, that they're finding that someone does go to a pop-up, gets their booster, but doesn't cancel their existing NHS centre booking, which means that what they're having to do is ring round, is double check. What they're doing is they're checking the patients they've got listed for vaccine that are coming forward for vaccination against the record to see whether they've gone somewhere else, and then phoning them to make sure that's the case, and then phoning their sort of reserve list, if you like, to see if there are people who want, because obviously they've got vaccines that they're not putting in arms, and they'll then go to people who've said, yes, call me in early if you can. So it's a big administrative headache, because people aren't, and this is a message to the public, I guess, Martin, that we want to get out. People aren't cancelling their bookings when they're getting jabbed elsewhere. They did have a limit on the vaccine batches they could get hold of, which meant they were limited in the number of arms they could jab, but that seems to be getting sorted. And they're waiting to get permission for second vaccination pod, because at the moment they've just got the one operation, but the intention is to have two, which would then double their throughput, and that would obviously help all of us. So that's the general comments. And we then discussed the clinical reasoning for the 15-minute wait after Pfizer. I don't know whether that's after the other jab as well, but I was taking Pfizer. Neither of us could actually, whether there was any clinical evidence for the need for a 15-minute wait, because his comment was that he hasn't really seen anyone, maybe one person he's had who's actually been affected by the vaccination, sufficient that they need to wait for a bit before they get up and move around. So there's those comments. I just passed them on from Graham Jones, who you know very well, and leave those with you. Now move to members. Councillor Bell.
Thank you, Chairman. Thank you, Joe. I've got 2 points to raise. First of all, the jab van doesn't go very far east, and I just wonder whether there's a reason for that, or whether we're missing an opportunity. And then before you answer, Joe, just to Graham's point about the 15-minute wait. When I had my booster, I waited for 15 minutes, but those who were preceding me or coming after me, many of them just left after 5 minutes or so. So just added that.
So yes, you're right. I've tried. I think coming up to Christmas, availability of community venues is restricting how far east I can go. However, because the West Reading Villages PCN has been participating in the vaccination programme the whole way through, take-up of boosters in the east of the district is very good and outperforming the areas in the central and western parts of West Berkshire. So for that reason, I needed to prioritise more central and western locations.
Thank you.
Certainly, I would say, although I deliberately went over to Lambourne for the publicity purpose, had I wanted to be vaccinated locally, the PCN in Mortimer, which is part of West Reading Villages, the surgery in Mortimer, which is part of the West Reading Villages PCN, is certainly, they are doing the jabs in their own pharmacy, and I know that Boathouse Surgery at Hangbourne has stepped up. So that, you know, that piece that we've seen, the reflection between what happened in the first round and second round and what was being done at the racecourse, no longer being available through the other three PCNs, is certainly reflective in the east. So I do follow why you're concentrating, Joe, on the western end and the centre. Councillor Vickers.
So sorry, Joe, could I just come in on that? Sorry, Councillor Vickers. There is a point here that a community like Thatcham has 2 surgeries and they've got a van. There's that bit in kind of between, let's say, Calcutt and Thatcham, where there are we just don't have access to those the surgery facilities and the pharmacy options. So I just wonder whether there's an opportunity there. We're neither one thing nor the other.
I'll leave Joe to take that back and have a conversation with Katie about it and come back. And maybe you can pick that up, Joe, with Councillor Bowick direct through Katie and whatever. Councillor Vickers.
Thank you. And thank you, Joe. Yeah, I've also heard of people being sent some distance from where they live, or seemingly unnecessarily for their jabs. I've just picked up some of these cards, which I raved about, I think, at the last meeting, to actually take around to different places in Newbury, because, they do tell you on the back where the places are where you can go and get your vaccinations. So one hopes that, when you do ring up, you can sort of double check that you're being sent to somewhere that's fairly local. I've left a batch of them in the library, Corn Exchange, Town Hall, and I'll try and distribute them around further. I was asked, this information was online. I've asked Alice about this, and I think she says it's probably there. There's a link, it's in a different format, but the card itself isn't produced online, because obviously that's where a lot of people will be going to find out where their nearest place is to get their vaccinations. You mentioned walk-ins for Hungerford. I was wondering whether there are walk-ins in other places. I think I got my booster just walking into the Kennett Centre to make an appointment. They just said, "Oh, we've got space. Our practitioner is here, and we'll just do it. Well, we haven't got any appointments." They just sort of grabbed people as they walked in. They seem much more accommodating than Boots, actually, to actually sort of, really sort of making the most of the practitioners they've got and not turning people away if they didn't have to. And it's really quite worrying to hear that maybe Lambourne appointments are being taken up by people outside Lambourne, because I'd have thought there's quite a lot of people from Lambourne who wouldn't be able to get anywhere else, and they need to have the availability to go to their local facilities for their jabs. I'm not thinking of the chairman here, but other people who might be sort of coming in from far away just because they've got transport. I think Graham Jones made lots of really good points via our chairman, and it might have been quite useful to actually have him here to sort of discuss some of his points, because he's obviously been thinking, about his residents and the availability of his vaccines. Thank you.
Joe, do you want to come back on any of that?
Yeah, there was quite a lot to unpack there, Martha. I think in respect to walk-in, so all of the Help on the Move van drops will be walk-in, and they will appear on the NHS website as available for walk-ins. In respect of the pharmacies, I'd have to go back to NHS England to ask about Boots, the Kennett Centre specifically. I'm aware from local reports rather than through any sort of official channels that frequently people are able to access a booster or whatever vaccine at the Kennett Centre on a walk-in basis. I believe that they don't advertise as such because they need to ensure that they've got enough supply for those with booked appointments. So it's one of those things where you can try, but it's not guaranteed. And your other points noted.
Thank you both. Okay, so we move on to the PPP. Sean.
Thank you, Chair. I've just got a 3-slide presentation, if I could just share that. Thank you. Does that come through okay?
Yeah, you're in.
Yeah, I'll just put it into main mode.
Just need
okay, brilliant. Okay, thanks, Chair.
Lovely.
So just really a quick update tonight on where we are in terms of contact tracing and isolation work, and then on the new requirements that came in last week, and what we've done as a service basically to try and address those, if I may, Chair. So in terms of our contact tracing and outbreak isolation work, the figures are still quite high for us. So the week ending the 17th of November, we had 153 cases referred. The week ending the 24th of November, we had 176. And I haven't got this week's figures yet, but they still look like they're remaining very, very high. We have brought in basically some additional resource to address some of this. So we have, I suppose, 3 dedicated people now within the contact tracing team who do most of the weekday tracing, and then the rest of the public protection staff actually tend to cover off the weekend tracing across West Berkshire and the other 2 PPP areas. So most of what we're dealing with at the moment, as won't surprise you from Matt's presentation, is mainly children and young people. So just in terms of isolation calls, we've conducted 588 in the last fortnight of isolation calls, primarily to cases, but to some to contacts of cases. And again, as we've always done, basically we have made referrals to the relevant bodies where they were needed for support purposes. And finally, basically, we are looking, and we have been having conversations internally, as Matt will know, basically about the model going forward for contact tracing. There's quite a bit of uncertainty. Obviously, we don't know quite where the national system is going long term. We don't know what's happening beyond the end of March in relation to funding, but we are actually having a look at see whether there are, in particular, very specific postcodes and things like that we should be looking at, perhaps in a bit more detail going forward. So just looking at the new measures that came in over the last few days. So it's widely known that face coverings are required in shops. Now, the definition of shop is pretty wide, actually, within the regulations, and pretty well includes everything that's for retail sale of goods or services, with the exception of primarily hospitality. And obviously, everybody that visits those premises is required to wear a face covering, lesser exempt, and including obviously children. It also applies to staff actually at most of the premises. So this is one of the questions we've been asked: is our staff actually required to wear face coverings? And in fact, in virtually all circumstances, there are 1 or 2 minor exemptions to that around financial meetings and things like that. But yes, staff generally, unless they're exempt again, are required to wear face coverings. What I would say is that the shops themselves aren't required to enforce it. And this has been one of the issues all the way through. But we have been having conversations, and I'll come back to that in a minute, with shops and managers about this issue. They are required to have compulsory signage for shops, and this is basically to explain to the public that actually face coverings are mandatory unless you're exempt on those particular premises. Now, this was quite a challenge actually for some of the retailers, because obviously the regulations came in at quite short notice. A lot of retailers still had signs basically up sort of saying, please wear one if you can. Back from the kind of voluntary scheme, I suppose, that's been in place now for several months, really, where it was more about encouragement than a mandatory requirement. There's also basically a requirement to wear face coverings on public transport, as you're aware, but that also includes taxi and private hire vehicles. And it also covers things like driving lessons and driving tests, most of them anyway, for normal car drivers and things like this, unless you're exempt. As I say, the enforcement basically primarily in relation to the public issues is a matter for the police, but there are powers in there for certain transport operators to enforce in transport settings. But the business requirements, basically, particularly those that relate to things like signage, are a matter for local authorities, and in that case, obviously, ourselves in the Public Protection Service. So finally, what are we doing about it? What have we done about it? So we have basically produced very, very quickly point of entry signage and that for businesses, in particular for smaller businesses and independents and convenience stores and the like, and that is available and has been made available to them, and actually as part of the sort of general visits is being distributed where they're missing. We have also produced the same sort of signage that's required for public transport, and in particular taxis and private hire, and that basically again has been made available to the trade, so they're required to have that signage in the vehicle. We've been in contact we're in contact with taxi and private hire operators and drivers, just basically to explain the requirements and to just make sure that basically they're being complied within those settings. The licensing liaison officers, Chair, that we have, basically they have actually been handing out signage and also things like face coverings and things like that, where there's whether somebody may need one or a customer may need one. We have carrying out some advisory compliance visits to higher throughput premises. So these are the ones where there's more perhaps density of people on the premises, really to discuss with management, I suppose, really how they manage compliance issues, how they deal with, for example, issues around customers that may not be exempt but just refuse to wear face coverings and things like that, and how they manage the risk around that for their staff. But I think it's fair to say that in most of the settings, and people on this panel will have seen it themselves, the compliance rates seem pretty good, actually, pretty high. And then finally, basically, we continue with our work around events, continue to review event risk assessments and carry out visits to those events. So that's a kind of brief update from me, Chair. I'm happy to answer any questions.
And do you have one from Councillor Stewart, or perhaps more than one? Councillor Stewart.
It's not a question. It's to say that I attended the Shaw House Christmas event yesterday, and just to congratulate the team on a really well organised event. I was pleased to see that the majority of people who attended were complying and were wearing masks. I will say it was a bit of a chilly day, even though we were inside, but that's because it was clearly being well ventilated. And I think, the fact that we are leading by example, I think is really important. So I just wanted to say congratulations to the team for doing exactly that and leading a really well organised event for us.
Chair, can I just add to that? I was in town myself, obviously, when we had the Victorian Fair, and I think it's an important point that Councillor Stewart makes. And even though most of that, obviously, in fact, all of it was outside, I suppose, primarily, there was still a lot of people wearing face coverings in the crowded settings. Okay, and again, I think that was a kind of very encouraging sign that obviously there's the kind of new environment around some of the rules, basically, although it's not required in that setting, basically just filtering through.
And it may be useful to reflect on that, Martin, when we put out any comms about anything, that that the residents of Newbury and more generally West Berkshire certainly look to be stepping up to the plate and complying with the non-rules, external non-rules, to the benefit of all. So it's something that we might reflect on. Councillor Vickers.
Thank you for that, Sean. It's good to hear that you're supporting the businesses, because it must be very difficult for people that don't comply, for the staff to be able to approach them. And I think they're actually being told not to approach them, aren't they? Not to challenge them. But are you saying that you're actually trying to help them to do this in a sort of constructive way, or sort of how to approach them? Or are you just accepting that they don't want to put themselves at risk?
I think it very much depends, Councillor Vickers, on the setting, really, doesn't it? If you've got dedicated staff who are there, basically security staff and things like that on doors, then obviously they're in a very different position, for example, to perhaps somebody that is not trained to deal with security or related issues. So the conversations we've really been having is, have you thought about this? I mean, it may well be that the advice is for people not may well be, but quite often the advice will be not to get into confrontation with people, but to just report it to the relevant authorities. So that's just part of the debate we've been having as part of visits to look at overall kind of compliance with guidance. And as Matt will know, that there is new guidance coming out all the time, isn't there, Matt, particularly around ventilation and testing other things. So whilst we're having those conversations, what we're saying to them is kind of, what are you doing really, is, what are you doing to sort of look after your staff? What are you doing to make sure your staff don't put themselves in danger, that type of thing? Because this is a matter really for the relevant authorities or for people that are trained to deal with it.
Yes, exactly. Thank you.
Thank you.
Thank you both, and thank you to Jo, who has sent me a chat message to point out that I didn't go to the second part of her presentation. So slapped wrists here. Jo, would you care to continue with your vaccination piece? And then we will come to Martin. Martin, take a note of the time.
Well, I thought I got off lightly there, but You know how much I love to show off the government dashboard, which has just been updated to show booster take up by local authority area. So I thought that might be of interest. This is all available to the public. So I've just zoomed in to show particular booster doses, because I think that's where a lot of our focus and energy is at the moment. So overall, 52,000 plus booster doses have been administered to West Berkshire residents. This graph just shows you activity by day. So you can see that Saturdays tend to be quite busy and it's a bit quieter during the weeks. And the last couple of days data in the grey here is incomplete, but showing good level of activity over the weekend. So I'll just scroll down. So overall, this is showing that 35.6% of the West Berkshire population aged over 12 has received a booster. That denominator is not sensitive to any sort of time frame or eligible cohort. That's just of all our population over 12. And then coming down into age demographics, the above the 90s, 85 plus, 80 plus, going down to about the 70 age group, sorry, it's showing about 90% take up of a booster. And as we come down the age groups, so we've got 80% take up in the 65 to 69s, 62% take up so far in the 60 to 64s, and then those that will be getting their boosters at the moment, the over 50s, got about 47.6% in the 55 to 59, and 40% in the 50 to 54. So it's good to see that those who are most vulnerable in terms of their age, we've got a good prevalence of take up, and it will be interesting to see over the next couple of weeks what our increased capacity locally does to those figures. While I'm on uptake by age, I just wanted to touch on take up by 12 to 15-year-olds, which is showing at just over 62%. I was linked to a Guardian article this morning, which recognised that West Berkshire was picked out as a local authority with a particular high take-up, noticing that trends in the southeast for 12 to 15 vaccinations were very good, but West Berkshire was particularly named as an area with very good take-up. So I think all credit to the schools and the school age immunisation service there for the great job they've done, and to those parents for engaging and where they've missed out, making sure their children have been able to get a vaccine. So that's the light version. If you would like the more intensive version, I'm happy to go through the slide deck that is traditional, but I am mindful of the time, so very happy if we'd rather leave it there for today, and I'll hand over to Martin.
Well, I think that tells us the story that we need to be told. Certainly what is, from my perspective, correct me if I'm wrong, it looks like people are getting booked in to take the booster when they can, for the most part. And I mean, one would think, actually, if you have gone and got your first dose, you're going to, generally speaking, you're going to go and get your second dose, and you're going to go and get your booster, because once you've made the decision to be vaccinated, I would have thought, that you go ahead and get fully vaccinated. If you've started on the journey, you want to complete the journey. But certainly what you were showing on the booster numbers appeared to be saying that people are taking up the offer when it's available to them. But I suppose, as with all things, time will tell, won't it? Anything to come back to me on that?
No, just to reinforce your point there about take-up of boosters, I think they're, because of how the booking system has worked, and you've drawn out some of the the issues or the quirks of that system. I think we will see, and have been seeing, a little bit of a lag between that group that is on the nose of their 6 months of being eligible, and then just that lag between when they've actually got booked in. So I think that is it's definitely, I'd say it's telling us a story that people are coming forwards, they are booking. I think there is a clear difference that we're hearing for sites as local as possible, and that people will come forward as soon as they can get in somewhere that is, you know, that works for them, that they don't have to travel really far to. So I think it's, you know, it's definitely a lesson for us when we're planning deployment of the vaccine, is to try and get as local as possible, and that the mass vaccination centres have certainly served their purpose, but definitely local provision is far more appreciated.
Councillor Masters.
Thank you, Chairman. Thank you, Joe. Pretty good explanation of what the situation is. Thank you. It's just a question about the data and how that's collected. Is it the location of the vaccination or the location of the registered address of the vaccinated that is recorded there? Just, you know, because, you know, I'm listening to Councillor Bridgman and the experience of Councillor Jones, you know, people come in from Wantage, etc. And then myself, I had mine out of the area, out of outside West Berkshire on Saturday. And I just wondered whether that's how that data was collected, you know, on what data point, location, or address.
So this data all comes from the National Immunisation Management Service. So when your vaccine event is recorded by your pharmacist or your nurse or the team at the mass vaccination centre, that is recorded according to your address of residence. So this is showing us West Berkshire residents rather than vaccines administered inside the boundary of West Berkshire.
Thank you. That's what I thought. I just wanted to clarify. Thank you.
Right, I think you are now let off the hook, Joe. So sorry about the two-parter. Martin, over to you to tell us all about comms.
Lovely. Thank you very much. I do just have a couple of slides which I'll get up now. Mindful of time. Sorry, yeah, can you, sorry. Mindful of time and the fact that much of what I've covered has already been discussed by Matt, Joe and Sean variously. I can just give you a bit of an update on where we are in terms of the key activities which we've been working on since this group last met. Restrictions and new rules that have come into place last week have obviously been an important part of what we've been doing, and as Sean said, came in quite short notice, so we've had to work quickly to let residents know about what is going on with mask wearing, travel, and changes to self-isolation rules. Vaccinations has been an important strand of what we've been doing. We've been working with Jo and her team on the Hungerford booster pop-up, supporting their communications to let people know what's available, and offering, as Jo said, our booking system, which has been well received in terms of helping people to book onto those as well. Additional services there in Kinderbury and Lambourne also. The booster cohorts have changed. It's open to everyone now on a cascaded by priority. So we've been working to ensure residents know what's been changing there and when they can come forward and get theirs. And as you said, sharing your booster and Councillor Doherty's earlier today as well, which I think is really important in terms of community leadership. So being seen to practice what we preach. Very pleased to be able to share that. I'm grateful that you invited us in for that. And then, of course, lateral flow tests as well continue to be really important. The rules or the guidance rather has changed with regards to when you should take those from twice weekly on a blanket basis to a more nuanced approach. So it's based on risk now. So if you're visiting high-risk people, going to an event you know is going to be busy, or indoors, for example, you should be taking tests. And we've been supporting our assisted testing service as well and through that, Solutions for Health and Health Watch at West Berkshire to make testing as easy as possible for people. So my second slide, just to give you a couple of sort of visual examples of what we've been sharing over the past couple of weeks, both sort of that booster information earlier on today, but our COVID newsletters as well. And the newsletter is really continuing to be a really important part of what we do, to be well received by residents, and I think show that they continue to be engaged in the situation locally and what they can do to keep themselves and others safe. So this newsletter on the left-hand side we sent out a couple of hours ago. It's already been read or opened 13,000 times, which I think is pretty good. And again, the newsletter we sent out yesterday, helping drive 1,300 people through to the COVID booster booking page, which again is I think really important, and social media and sort of those non-digital channels too. So mindful of time, as I said, a whistle-stop tour. Happy to take any questions, but that gives you a flavour of what we've been busy with over the past few weeks.
Thank you, Martin. Martha.
Thank you for that. Yeah, just a bit concerned that I'm not sure that the message about testing, if you're going to a busy or an indoor event, is got through to people. I mean, I'm just bearing in mind some events that I've been invited to, and I'm sure people aren't, it's not being suggested that they test. Of theatres, are they asking people if they're going to performances to test before they come? I mean, I'm just not quite sure that this message is getting through. Are we doing any more to promote this?
Yes, yeah. The guidance only changed fairly recently, so we have begun sharing those messages, and we'll continue to do so. We recognise that sort of particularly in the run up to Christmas, people will be visiting friends and family more, and particularly potentially some high risk sort of family and friends going to busy events. And we want people to know what they need to do and when. As I said, people have been engaged sort of pretty well through the pandemic, and I'm sure if we share the information, people will continue to do what they need to do to keep themselves safe. So this will very much be a key message as we go into the Christmas period. Sean, do you want to come in on that as well?
Yeah, Chair, I was just going to add, actually, thinking about it, actually, it's an important point that Councillor Vickers makes. What we'll do, Martin, maybe we could pick this up directly with some of the venues as well in our kind of routine communications with them. So I'll go away from this board and pick that up, Chair, see whether we can get that communication out.
Fine, thank you for that. Okay. Well, we're back to the usual question of future meetings. And what I'm going to say is very much what I said last time round, which is I think we are very much to be guided by Matt as Service Director and Tracy as Director of Public Health on, in conversation with me, I guess, on whether or not things are changing sufficiently that we need to hold further meetings of LOEB. And if so, when those should be, how, what the timescale and what the time frame is on period. Now, therefore, I will simply leave it open that there may be a further meeting of this board in the not too distant future. I would guess that if it happens, it will be in a fortnight's time, wherever that takes us to. But Gordon, please note, but really, Matt, I leave you to have the conversations you need to have to and advise to the extent you want to advise us as to what you think we should be doing. So members, with that, unless anyone has any points they want to raise, I will call this meeting to a close and ask you to stay in the room till Gordon has confirmed that we've stopped streaming.